Hey everyone, Bridget here at the AAFE Training Center. We are going to be doing some talks on my patient this morning. Ignore the little bruises on her lips. We did some lip filler, and she tends to bleed a lot when we do that. So I'm just going to go through her tox treatment with you guys. We're treating almost a full face of neurotoxin. So I'm going to treat her frontalis. So I'm making sure to treat all the way out to those lateral borders on either side to prevent any spocked brow. And then she has movement all the way up into her hairline, so I'm going to be treating all the way up there as well. I came up with her dose. I've seen this patient a few times, but I've came up with her dose just by the set of her eyes, how much movement she has, which is not a ton. She has very, very, very fine lines. So we just do just a little bit of tox in her forehead just to kind of keep things nice and smooth. But like I said, she doesn't have much to correct up here. So I'm just kind of spacing those out evenly, maybe about a dime nickel size apart. I tend to do a little bit tighter of a dilution, so I have to do a little bit more injection sites to get me enough spread. But I do add a little bit of saline as well. Then for her glabella, I'm going to be treating her procerus in 2 corrugators. So I'm going deep down on bone, 90 degrees for her procerus, and then on the medial corrugators, I'm doing 3/4 my needle depth. And then the lateral corrugators are really important to make sure you're staying more superficial. As you can see, she's still pretty frozen from the last time, which is pretty good. That got her about 4.5 months. So I kind of stuck with what we did last time because clearly it's working for her. But usually I will just have them make an angry face and come up with their dosing just by, how much movement they have. This muscle is a depressor at baseline. So the higher that you treat the glabella, the more lift they're going to get in the medial brow. She does have a little bit of hooding, so I do go a little bit more aggressive as well. Around the eyes, so her crow's feet, I'm staying very superficial, so that muscle is really, 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 really skinny. So I try to stay really parallel with the skin. So really just my bevel is going in there and treating the orbicularis oculi muscle. I'm always making sure to stay just outside of my orbital rim to prevent any negative side effects dealing with the eye, like dry eye and things like that. So I'm doing the same thing on the other side. I'm pointing my needle away from her eye and I'm going very superficial. The crow's feet is kind of what helps you get that lateral brow lift. You can also treat further up into her brow and that will give it even more of a little bit of a lift. I'm treating all the way to where I have movement though. If you don't, then the muscle's going to recruit and then she's going to have all of her movement down there. So you can see that I'm now treating higher up into her brow for a little bit of a brow lift. She likes a little bit straighter of a brow and you can see that her brows at baseline are more arched. So I just kind of did a little bit in the tail of her brow. I'm moving down to the lower face now. We're treating DAO, so for the downward turn of the mouth. So I'm going to make sure to go very superficial there and away from her DLI. In the mentalis, I'm going about half needle depth. And like I said, I came up with her dose, just like everything else, dependent on her movement. She also loves doing a lip flip. Even though we did some filler, it can still have that muscle curl under, so you can still have that disappearing of the upper lip. So we just wanted to do a little bit of a combo treatment. So I plan to see her back at 2 weeks. Thanks so much for tuning in.